Health authorities in Victoria believe the Delta strain of coronavirus, which has infected 2 Melbourne families, leaked out of hotel quarantine.
The national database, which stores genomic data from returned travellers, is being re-examined.
5 new local coronavirus cases recorded on Saturday. 2 are the more infectious Delta strain of COVID-19, taking the cluster to 9.
One case is the second child of the family of 4 linked to the North Melbourne outbreak.
The 2 families of 4 have children at the same primary school. The first group spent time on the New South Wales South Coast last month. A workplace contact of one of the parents has also tested positive.
In terms of the North Melbourne primary school that we discussed yesterday, now 339 primary close contacts, 82% of them have now returned a negative test result. There are about an additional 100 primary close contacts in the wider West Melbourne cluster at this point in time.
Do you have a suspicion about how the Delta variant might have made its way to Melbourne?
My strong hypothesis is that it's come in through a importation from overseas through our quarantine hotel system. That would be the most likely. Couldn't say.
No new local cases have been recorded in New South Wales out of more than 19,000 tests. Health authorities say it's unlikely the virus is circulating there unchecked.
The only thing that could rule that out is extensive testing in the Jervis Bay area and no further cases. So that's happening right now.
All genomic data from returned travellers in hotel quarantine is stored on a national database called AusTracker. At the moment, there are no matches to the Melbourne cases, but not everyone is able to give a clear reading.
We can identify the sequence in about 80% of positive cases. So why can't we get the sequence from 100% of cases? Well, for 20% of people in hotel quarantine, they've either got their virus levels are too low in order for us to get the genetic sequence, or they're at a phase of their illness which is only fragments of virus there, or the genome sequencing just doesn't work. It will happen on a small percentage of people.
2 more unlinked cases are of concern. A person who regularly visits a shopping centre north of Melbourne, which is an exposure site, and their partner, who's a construction worker. They're believed to be part of the Kappa cluster.
You should look at all of the exposure sites that are listed and not just reflect on the specific times and days for those exposure sites, but if you're a frequent attendee of some of those shopping centres in particular and you don't know the exact times and dates that you might have been there, that you should think about getting tested.
Julia Bradley, Sky News, Melbourne.